Welcome to Biochem Chronicles, and today we are focusing on a very important topic where there is a question in almost every examination, that is glycogen storage disorders, and in under less than 10 minutes you will be able to remember this for a lifetime. So let's quickly brush up our knowledge on glycogen. So what is glycogen? It is nothing but the storage form of glucose. So where it is stored? Liver and muscle. The synthesis is known as glycogen synthesis and the breakdown is known as glycogenolysis. So when you consume excess food, the glucose is stored as glycogen and the rate limiting enzyme is glycogen synthase. So when this is absent, it is a type 0 glycogen storage disorder, and this synthase will cause alpha 1,4 linkages. So there's another enzyme known as branching enzyme which will cause branches with the help of alpha 1,6 linkage. When this is absent, it is type 4 glycogen storage disorders. So when you need energy or when you are fasting, this glycogen is broken down, and again here the rate limiting enzyme is glycogen phosphorylase. In biochemistry, it is important to know the rate limiting enzymes. With a nice mnemonic, I have attached a video below. You can go and check it out. So this glycogen phosphorylase has two isoforms, a muscle and a liver. When the muscle is defective, it is type 5, and when the liver is defective, it is type 6 glycogen storage disorder. So we saw that there is branches in the glycogen synthesis, right? So we need to break them. So we have a debranching enzyme, and the defect of this is type 3 glycogen storage disorder. And before getting released as free glucose, there is important enzyme known as glucose 6 phosphatase, which is present in liver but absent in your muscle. And the defect of this is your type 1 glycogen storage disorder, which is a very important form. And I have a quick easy trick for you to remember whether it is a liver or a muscle glycogen storage disorder. If you have a patient with fasting hypoglycemia, it is a liver glycogen storage disorder. If a patient complains of exercise intolerance, it is a muscle type of glycogen storage disorder. And here I have the master table to remember your GSDs in a very simple way. We'll look into each of these one by one. So before that, type 2, type 5 and type 7 are your muscle forms of glycogen storage disorder, whereas the others are your liver forms. There are many types of GSDs, but these 9 are very important ones you need to know. Okay. So first, coming to type 0, just remember 0, that is no glycogen. So there is no synthesis. So glycogen synthase is the enzyme that is deficient here, and since it is a liver form, fasting hypoglycemia is the most common symptom. So next is type 1, as I told, is a very important one, 1 Gurki. Just remember glucose. Gurki, glucose 6 phosphatase is the enzyme that is defective. So here the severe fasting hypoglycemia, also the child will have doll-like facies, increased uric acid is hyperuricemia, and increased lactic acid, that is lactic acidosis, and then also there will be increased triglyceride levels. Okay. So next is your Pompe type 2, which is also a lysosomal disorder. Okay. So what are the other lysosomal storage disorders you know of? Can you remember the sphingolipidosis and mucopolysaccharidosis? They are also lysosomal storage disorder. So for Pompe, remember acidic pump. Why acidic pump? Acid alpha glucosidase is absent in your Pompes. Okay. So it is a muscle form, and cardiomyopathy, which will pump blood, heart, right? So heart cardiomyopathy is the main hallmark feature. Also the baby will be generally floppy in nature. Okay. So moving on, next is your Cories. C 1 2 3 3 C CD is the memory trick you need to remember. So for Cories, it is debranching enzyme that is defective. So because there is a limitation in the breakage of your branches, there is a product accumulated which is known as limit dextrin. Therefore, Cories is also known as limit dextrinosis. Okay. So then we have type 4 Anderson. It is easy to remember AB. AB means Anderson adds branches. Okay. So here it is kind of a very severe form of your glycogen storage disorder, where you can see cirrhosis of your liver, and there is accumulation of a product known as amylopectin. Therefore, Anderson is also known as amylopectinosis. So then coming to type 5, McArdle's. Just remember M, McArdle, M for muscle and M for muscle glycogen phosphorylase, which is defective. So what did I say when there is a muscle problem? They can have exercise intolerance, right? So that is a very important feature. Also, another thing known as second wind phenomenon is a very important one in your McArdle's disease. So then is your Hers disease, type 6, H for Hers, H for hepatic, hepatic means liver. So the defective enzyme is liver glycogen phosphorylase. So liver means what is the common symptom? Fasting hypoglycemia. So here you have mild fasting hypoglycemia. Then coming to 7, Tories. Tories, remember tired runner. Why tired runner? Because it is a muscle form of glycogen storage disorder and they have an exercise intolerance. Another hallmark feature is hemolysis. So when you see hemolysis and exercise intolerance, think of Tori. The enzyme that is defective here is phosphofructokinase. So then we have type 9 GSD. So there's no specific name for this. So this Roman number 9 looks like K, right? So why K? Phosphorylase kinase is the enzyme that is defective here. So here they have hepatomegaly and growth retardation and it's a mild form of glycogen storage disorder. It was just easy to remember all of this in one table, right? So if you know this, you will be able to answer your questions easily in exam. And for more such videos, like, share and subscribe by Chem Chronicles. So before we end, let's check how much we were able to understand and remember. So which glycogen storage disease is also classified as a lysosomal form? Only one was there. What was that? Acid pump, Pompey's. So was it von Gurke's? No. McArdle's? No. It is a muscle. Anderson also? Again no. So the answer is Pompey's. So next is second question. A child presents with hepatomegaly, doll-like facies and severe fasting hypoglycemia, lactic acidosis, hyperuricemia and hypertriglyceridemia. So which enzyme? Where did we see all of these features? Von Gurke's, right? So which enzyme is defective here? Glucose-6 phosphatase. So debranching enzyme, what is the defect? CD, Cories. So liver glycogen phosphorylase, liver hepatic Hers. What is branching? AB, Anderson. So glucose-6 phosphatase is your von Gurke's. So the right answer is von Gurke's because that is where you will see all these features. So next is third question, last question. A child has hepatomegaly, okay, fasting hypoglycemia, which means something related to liver. But the lactate level is normal, which means it is not von Gurke's. So liver biopsy demonstrates accumulation of limit dextrin. So this is a limit dextrinosis disease. So which is the most likely diagnosis? Where is limit dextrin accumulated? Cories, right? So the answer is Cories. Is there anything accumulating in von Gurke's? No. Hers, is there anything accumulating? Anderson's? Yes, so it is also known as amylopectinosis, but amylopectin is not what is present here. So the answer is Cories disease. So with that we come to an end. You can scan this QR code for the PDF of the compiled table, and for more videos subscribe to our channel. Until then, enjoy biochemistry. Thank you and have a great day.